Welcome, and thank you for joining us. Today, we continue with our series on preventing high blood pressure and its complications. Today, the focus is on kidney failure and uncontrolled high blood pressure. Joining me today is Dr. Lamin, kidney specialist or nephrologist, who will help us to better understand the connection between uncontrolled high blood pressure and kidney failure. So Dr. Lamin, help us to understand what is the connection, because I don't think that people know that the kidneys have a major role in controlling blood pressure. So help us to understand the connection.
Well, there are several connections. The first interesting connection that probably more people are aware of is that persons with high blood pressure, and particularly uncontrolled high blood pressure, or persons with, from certain ethnic backgrounds but with high blood pressure, even on medication, are very high risk for the development of kidney disease. The most commonly appreciated organ that's affected by hypertension is the heart, and the development of atherosclerosis and heart attacks. Another common consequence of high blood pressure is our strokes. Right. And the third major organ system affected by hypertension is the kidney system, and with the progressive loss of kidney failure as well, particularly as blood pressure is less well controlled. What's not as commonly appreciated, though, but is seen both in laboratory animals and in our patients, is that the kidney failure state in and of itself also frequently induces high blood pressure, such that in the dialysis unit, regardless of the cause of kidney failure, it's very uncommon, although not unknown, but it's uncommon to find a patient that does not have a diagnosis of hypertension and is not on medication for this.
Right. You mentioned earlier certain ethnic groups, like which ones?
Well, as a nephrologist, one can't help but notice that the striking incidence of end organ damage in blacks with hypertension. So, for instance, there's data showing that if one compares a white patient and a black patient and matches them for gender, socioeconomic status, educational background, one finds the incidence of end organ damage like kidney disease some 7 to 10 times higher. So as a nephrologist, when we see blacks with hypertension, it's a signal to us that we need to be extra aggressive with these patients and making sure that we get their blood pressure as controlled as possible. More treatable kidney illnesses are those that tend to be associated with the presence of protein in the urine. So sometimes these will be picked up before a blood test because of the presence on a routine urinalysis of protein in the urine. But in the absence of protein in the urine and other markers, sometimes can be very difficult to pick up the high blood pressure until it's too late.
Well, how exactly does the kidneys control blood pressure?
The kidney's major influence on high blood pressure directly under normal conditions is through a compound known as renin, and that triggers a whole series of pathways that fall under the terminology renin, angiotensin, aldosterone system. But the bottom line is what this system is designed for is for states of when we're dehydrated. And basically when we haven't had enough access to water, or we've had too much fluid loss because of vomiting or diarrhea, and the kidney has a signal or receives information that we're dry and sends out a signal that works its way throughout different organ systems of the body, but that comes back to the kidney and causes the kidney to retain sodium. And when the kidney retains sodium, we retain water, and when we retain water, we fill up our blood vessels, and there's more fluid in the blood vessels, and that raises our blood pressure. So that's the most common and basic and normal way in which the system is designed to raise the blood pressure. Unfortunately, this becomes pathologic because this normal regulation breaks down in some hypertensives, and there's an excess signal that under normal conditions we saying the body's dehydrated, even though the body's not dehydrated, and it causes the kidney to retain sodium and to retain water, whereas under normal conditions it would be much better for those patients to just pee out all that extra salt and water. And that's one of the reasons for hypertensive patients we frequently use diuretics. Because a diuretic pill, which a lot of hypertensive patients are very familiar with, causes a person to pee out salt and water and decreases their blood pressure.
So essentially, in our body, we have this renin system that controls and regulates blood pressure.
Exactly.
And then it gets to a point where the kidney is no longer able to excrete extra water,
because
and we
it's
retain,
retaining.
because the kidneys are malfunctioned, and we retain fluid. And that helps to increase the blood pressure.
Right.
What about stress? We know that stress hormones are very bad for the blood vessels in the kidneys, and that can cause constriction or narrowing of the blood vessels, and as a result, the kidneys have to work twice as hard. Explain that.
Sure. The way I would describe it, I think, is what you're leading to is stress is bad for the body, and there's a lot of data indicating that. And when you drive the blood pressure up and you squeeze the blood vessels, that sends a signal to the kidney that we're dry. Because imagine if you had a pipe leading to the kidney and it squeezes shut because we're stressed out and we have all of those catecholamines surging through our system, then from the kidney's point of view, we're dry. And the kidney starts retaining salt and water and triggers all those unfortunate maladaptive mechanisms that cause our blood pressures to go up. So it's hopeful that that stressful state won't last very long, and as soon as that stressful state is over and the blood vessels dilate, then the kidney will pee out all that extra blood and, all that extra sodium and water, and will return to our normal state.
When we return,
People want to know, well, normal blood pressure, ideally, you want to keep it below 120/80. So at what point do we start to see kidney failure? Is it blood pressure 140/90, and for how long?
then later,
If one looks at a can of soup, that classically has a tremendous amount of sodium.
Right.
You might want to use that as a reference for something that has a lot of salt in it.
Do you think what we eat has any relationship with developing high blood pressure?
Yes, it does. Like a lot of salt, a lot of spicy foods, and that has a lot to do with high blood pressure, can cause it.
They say that, high blood pressure has to do with how much salt you eat and all that stuff. And I think, it's true, but I guess just recently we're talking about in class that, maybe it's not so much the salt that we eat, but it's more about the kind of genetics that you have. And so, it needs to be important. You need to keep in mind that everybody's different. And for most of the public, most of the people, salt plays a big role. And so, we like to put lots of salt in our food, but, it obviously raises our blood pressure. And so I guess that's one way. Too much salt is a bad thing, supposedly. For most people, it's bad for us, and it's going to raise our blood pressure.
Well, with regards to the uncontrolled blood pressure leading to kidney failure, what is uncontrolled? Because people want to know, well, normal blood pressure, ideally, you want to keep it below 120/80. So at what point do we start to see kidney failure? Is it blood pressure 140/90, and for how long?
Well, we don't see it at a specific value for a specific patient. But what the data tells us is, as a rule, the higher your blood pressure is, the more likely you are to have a cardiovascular complication. And cardiovascular complication will include heart problems such as heart attack, strokes, and the loss of kidney function. And the risk associated with damage from high blood pressure increases steadily as our blood pressure goes up from a normal value. And it's hard to exactly know what a normal value is, but even within the normal range, as the blood pressure goes up within what we consider the normal range, cardiovascular risk goes up significantly. So that someone with a blood pressure of 130 systolic would be considered normal and in fact controlled, but their cardiovascular risk is considerably higher than someone with a blood pressure of 110 systolic, even though both of those numbers are considered in the normal range. There's a misperception that blood pressure is controlled, everything is fine, then blood pressure
Right.
goes above a certain number, and then everything's not fine. When in fact, it's more of a continuum. As your blood pressure progressively rises, one's risk goes up considerably.
Right, so going back to my original question with regards to at what level do we see manifestations of kidney failure? So it varies.
Yes.
So it is an individualized phenomenon.
But the longer the blood pressure is allowed to remain high and uncontrolled, and the higher it's allowed to remain, the more likely as a person will suffer from a stroke, a heart attack,
Okay.
or kidney disease.
So what are some of the symptoms people should watch for that can indicate a possible kidney failure?
Unfortunately, there are not many symptoms associated with kidney failure until patients really get to the point where they need dialysis. Some patients do have warning signs, but it's not a warning sign that one can reliably predict and tell someone, well, if you have this sign or symptom, you should get on this right away. I think by the time a patient has signs, or rather clinical symptoms of kidney failure, and they come to the doctor, the kidney failure will be extremely far advanced. Even for patients with very far advanced kidney failure, it's not too late to do anything, and in many cases we can institute measures to slow further progression of the kidney disease and keep people off dialysis for a while, but eventually those patients will unfortunately end up on dialysis. By contrast, a lot of the patients we were talking about initially were hypertensive as the sole cause of their medical problem, usually do not classically have protein in the urine, and so they don't get the warning signs associated with having protein in the urine.
Okay, well, most importantly, this is very important information people need to know, but people really need to know how to prevent this from happening, because if you can prevent this, you wouldn't get to this stage. So let's take a break. When we come back, we will talk about things you can do to prevent this from happening, and we will also talk about dialysis, the whole process of dialysis, so we can better educate people what dialysis is all about and what patients who are on dialysis can do to minimize complications even while on dialysis. We will be right back.
When we return,
If one looks at a can of soup, that classically has a tremendous amount of sodium.
Right.
You might want to use that as a reference for something that has a lot of salt in it.
So how do you think people can prevent the blood pressure or complications of blood pressure?
Well, to prevent blood pressure, I think the obvious things are, exercise and eating good food and eating healthy. When you exercise, it helps. They say that, I know that, when you exercise, it certainly brings down your blood pressure, and that's very helpful. And so, yeah, definitely to bring down your blood, what you can do about food and hypertension is definitely you can eat good food. You can eat your veggies and your fruits and all those things. Those definitely help bring down your blood pressure. And to add to that, you can add exercise to that, and that also helps control not diabetes, but hypertension.
Welcome back. With me is Dr. Lamin, and we have been talking about uncontrolled high blood pressure and kidney failure.
Well, I think the two most modifiable things that come to mind are hypertension with development and control of high blood pressure and the development of type 2 diabetes. We
Right.
look at American dialysis patients, half of the American dialysis patients are there because of diabetes or with a diagnosis of type 2 diabetes in particular. So when it comes to blood pressure, controlling blood pressure, I would say look to your family, and if you have other family members with blood pressure, on blood pressure medication, that should be a signal to you to check your blood pressure periodically. That if we are concerned about the development of high blood pressure, if we have family members at risk, then we should start with things like regular exercise, increased level of physical activity, and also give strong consideration to limitation of the salt in one's diet.
Yeah.
Particularly, what's not very commonly appreciated, that packaged or processed food is home to a tremendous amounts of sodium. Even such seemingly benign things as candy bars, which in their own way are wonderful, have tremendous amounts of sodium, and that's a source that's unappreciated. So in my opinion, we should start early as possible with monitoring for hypertension, and if a person is at risk, again, that type of healthy lifestyle. You've mentioned stress a couple of times. It's very important, if possible, to minimize stress in one's life, although I have to admit that that's easier said than done. Every textbook I've ever read has recommended that, but sometimes that involves quitting your job and ignoring the rest of the stresses of your life, and particularly as a father of 3 small kids, elimination of stress is difficult.
Well, I think it's difficult to eliminate stress altogether. Most importantly is to learn how to manage stress. Develop the tools to manage stress and to know when to say enough is enough.
That's very important, and one also has to admit there's some people where their health is at such high risk that they might have to consider changing jobs because they can't handle the stress.
Right, and even if there is no existing family history and a person's lifestyle or lifestyle habits are really not too healthy, they are at risk because you may not have a family history, but you eat highly processed food, you eat a lot of salt, you are very inactive. That is concern enough to take action. And really, talking about salt, the recommendation now is about or less than 1 teaspoon of salt a day.
We like to recommend a very severe salt person would be about 2 grams of salt a day. So salt by law is on the product information portion, and one has to look at that as much as possible and compare foods and compare the amount of sodium of foods to get an idea of what's low salt and what's high salt. So for instance, if one looks at a can of soup, that classically has a tremendous amount of sodium.
Right.
And you might want to use that as a reference for something that has a lot of salt in it and compare that with some other packages in the grocery store to identify something that might have a lot less salt in it.
Okay, now let's assume, unfortunately, that the patient is on dialysis. That is rather unfortunate because that's end stage. What are some of the, first of all, explain the dialysis process because some people don't understand.
I think there's a lot of misconceptions that need to be cleared up about the dialysis process. Dialysis, whether we're talking about hemodialysis in the dialysis unit where patients go 3 times a week, or peritoneal dialysis that patients are doing at home 7 days a week, involves the replacement of the function of the kidney. The function of the kidney being both to clean the blood and balance the fluid and electrolytes, the water and the bloody chemistry. Dialysis is not therapy for the kidney. It doesn't help the kidney at all. For the most part, it is not harmful to the kidney unless excessive fluid is removed, but it replaces the function of the kidney. A lot of patients, in my experience, do not understand that distinction and think somehow that dialysis is therapy for the kidney. Unfortunately, it's not therapy for the kidney, but it does replace the function of the kidney. It's not 100% replacement of the function of the kidney either, but it's enough to cause a significant and dramatic improvement in symptoms. And almost without fail, most patients feel much better after they've been on dialysis for a while than they did before. And so what dialysis does basically is you run the blood through an artificial filter, whether it's the filter provided in the dialysis unit that's a plastic cartridge, or whether the filter that's created out of the blood vessels that line the abdominal cavity. And we run the blood through a filter and clean it.
Coming up on the next episode.
And if you're a big fat kid or a kid on the way to fat, don't eat those burgers. They're loaded with fat. Just don't eat them. They're killing you. Throw them down. Don't even go in those stores. They're killing you.
What do you have to say to the parents who buy it for them?
You're a fool. You don't care about your children. You do not care about your children if you buy that junk. You're in too much hurry. Busy, busy, busy. I got to do the job. I got to run. You don't care about your children. That's what I say to the parents. You don't care about your children.
Hi, I am Ruth Tanyi, producer of the award-winning TV series called Bad Sugar. Do you have diabetes? Know someone who has diabetes? Unfortunately, all of us do. So listen carefully to what others are saying about the Bad Sugar DVDs.
I have type 2 diabetes, and I've had that for probably 30 years.
I've had diabetes since 1995.
I've watched all of the Bad Sugar series.
I have had diabetes since 1998.
I've watched the TV series Bad Sugar.
I am a type 1 diabetic, and it's taught me how I can expand my lifestyle. It's taught me spiritually how to monitor my stress.
They clarified everything what the doctor was saying, but at a more slower pace, and to me, a very understanding pace to understand diabetes.
Oh, I thought I knew, but I didn't. I had little knowledge, but that series expounded my knowledge.
For me, bad sugar have played a major important role in my life to control, to educate, and to teach others about diabetes.
It showed how God operates through us and how we need to connect with God in order to make sure that those sugars operate the way that they're supposed to.
Bad sugar.
Do you have questions about nutrition and diabetes? What to eat, what to avoid, counting carbohydrates? What about the glycemic index? Or questions about proteins, fibers, fruits, vegetables, fats? Or do you have questions about exercise, stress, spirituality, and diabetes? Or do you want to prevent diabetes complications? The Bad Sugar DVDs will give you the answers you are looking for.
There was things out there that I didn't know, and since I watched Bad Sugar, it's given me a lot of information that will help me further out.
Type 2 diabetes affects a lot of different things in your body, which I never knew about until I saw the episodes 7, 8, and 9.
It's taught me about nutrition, it's taught me spirituality, and it's taught me how to live my life and enjoy myself longer.
I was able to reduce my medicine, and that's due to the fact of the bad sugar.
Call 1-866-257-3471. Operators are standing by. Or log on to PreventiveCareWeekly.com and place your order.
Okay, now you know all about the Bad Sugar Diabetes DVDs. Get them for yourself and they will change your life. So why don't you explain to the audience the differences between the two types of dialysis?
Okay. Hemodialysis is the process where we take the blood out of the body.
You go through the vein.
We take blood out, we create a large sort of vein underneath the skin, and typically in the forearm. And if a person's right-handed, we use the left forearm.
Okay.
And opposite if the person's left-handed. And so we remove a large amount of blood, but not too much,
right.
About 250 cc's. So by comparison, it's sort of a standard plastic bottle of Coke that we would get for a party would hold about 2 liters.
Right.
So we're taking about 1/8 of that at any one time. Take it out of the body, run it through a filter, and put it right back in.
And when you run it through the filter, what are you doing? Taking out the waste matters?
We're taking out the waste products, and we're also taking out extra things like sodium, and then we're giving extra what we call bicarbonate or extra base back, because one of the major functions of the kidney when it's balancing the body chemistry is removing extra acid.
So we're taking out the extra that the kidneys cannot because the kidneys are malfunctioned.
We take out the extra water, the extra sodium, the extra acid, and then we give back bicarbonate base. And so we dispose, it goes down the drain, and so we replenish and rebalance the person's body chemistry, all typically within a 3 to 4 hour session, depending on the patient's size.
And then the other kind of dialysis, peritoneal, goes through the abdominal cavity.
Exactly.
Explain that.
We use a small catheter or tube that's smaller than my pinky. And so it does, as you say, go through the abdominal cavity, typically low down. And it's very thin. Patient who's wearing normal clothing, no one could see that it's there. Mm-hmm. And so most of the time during the day, they're completely free with this little tube hanging out of their stomach. When they're home, they hook the tube up to an IV line with specially created fluid that we call dialysate. And so the fluid hangs above the person, and fluid comes into the belly, just driven by gravity, sits in the belly for a couple hours, depending on the patient, 2 to 4. And then they just hook up to another bag that's on the floor, and fluid just drains out onto the floor. And they just do that typically about 4 times a day.
And earlier, I asked you a question, and I interrupted you. I apologize. Now, during the dialysis process, what is going on with the blood pressure?
Well, Peritoneal dialysis, because it's done 7 days a week and 4 times a week, tends to be very gentle for blood pressure, unless overall we're taking off too much sodium.
Okay.
But hemodialysis is a very dramatic interruption of the body's fluid overall, because we're only doing it 3 times a week, and we're removing in those 3 to 4 hour sessions anywhere from 3 to 6 liters, and in some extreme cases, more liters of fluid. And each liter of fluid weighs about 2.2 pounds. And we only, under normal conditions, have about 5 to 6 liters of fluid in our entire bloodstream. So some people on dialysis are losing as much fluid as they have in their bloodstreams, because as we lose the fluid from the bloodstream on dialysis, we're recruiting more fluid from other sources of the body to go into the blood vessels and replace it. Unfortunately, the technology is so good as we can pull the fluid out of the body faster than the body can replace it back into the blood vessels. And in that interval, patients' blood pressure drops and can experience some discomfort.
Right.
And patients have to be educated to tell the nurses that they're feeling unwell, because otherwise the nurses don't know, and the doctors don't know for that matter, that for a particular patient that we need to be more gentle and remove the fluid more slowly.
Before we wrap up, we're running out of time. What are some of the lifestyle things patients can do at home to prevent worsening of the dialysis condition?
The key thing for a dialysis patient to limit and help improve their blood pressure control, their volume control, is to limit sodium in the diet.
And we talked about 2
sodium
grams.
makes us thirsty.
Yes.
And we cannot fight that thirst.
Yeah.
And if we eat salty food, we will have to drink more fluid. So it's impossible to ask a dialysis patient to restrict the amount of fluid, whether it's water or juice or soda, if they're going to continue to eat sodium. So the foundation of this is to start with better sodium control.
A lot of that is in soft drinks, so limit the intake of soft
drinks, potatoes, dairy products in particular. So that's a whole other area where dialysis patients really have to watch their diet. So.
And they should still exercise.
Oh, absolutely, because they still have, dialysis patients have extremely high cardiovascular risk, so all the things we talked about of limiting cardiovascular risk, lifestyle, stress reduction, and increased level of physical activity would all be extremely desirable.
And most importantly, being on dialysis is no excuse to stop taking care of yourself.
Exactly.
Because some patients have said, well, I'm on dialysis now, I don't care about the blood pressure, I just have to go to the dialysis center and the machine will do it for me. Well, you still have to do your part to stay healthy.
Yes, absolutely agree.
Thanks for watching us today. This is all the time we have for this show. For questions or comments, visit PreventiveCareWeekly.com and go to the message board and type in your question. And for more information about preventing hypertension, heart attacks, or other diseases, go to the forum and read what others are saying. And remember to also read the future article about preventing hypertension. See you on the next episode. Goodbye.
This program is not intended to be diagnostic or prescriptive. Please consult with your doctor or healthcare provider before adopting any of the lifestyle changes or other measures discussed in this program. We do not recommend any medication changes. Rather, patients should seek medical advice from their doctors or healthcare providers.